Well, all of us know that with primary care or preventive care, we can prevent many hospital visits that patients will make. If they don't have coverage, they wait until they're sick, so we're treating more sick care in the emergency rooms. Is there a provision in this Medicaid fund that provides for any primary care or preventive care?
Well, Medicaid generally, once you have access to coverage through Medicaid, I mean, it really is extremely helpful in helping enrollees access primary and preventive care. You know, and states are doing all sorts of things trying to implement medical home models and enrolling individuals in managed care, which helps to coordinate their care and assure them access to a doctor. There was a provision in the House health reform bill that is not included in the Senate version that would help to increase provider payment rates for primary and preventive care providers. So I guess that's one issue that, you know, if these bills pass the House and the Senate, one of these issues that will need to be worked out in conference. But that would, again, help increase provider payments, so hopefully to get more providers participating in the program to have even easier access once you have more enrollees.
We still have a number of people that don't know the difference between Medicare and Medicaid. Could you describe some of the differences?
Sure. Medicare is really our nation's nationwide program that serves the elderly and people with permanent disabilities. So it's a national program, and your eligibility for Medicare
is it a federal program?
It's a federal program, and it's based on your entitlement to Social Security. So there's no means testing, there's no screening if you're sick or for health conditions, and it's the same generally in every state. Medicaid is really the primary program for individuals with low incomes, and so it's a means-tested program, and it is, there are broad federal guidelines for the program, but the program is administered by the states, so essentially you have really 51 different Medicaid programs across the country, and states have a lot of flexibility to set who they're going to cover, what benefits they're going to cover, and how they're going to pay providers and arrange their programs. But importantly, Medicaid also provides a lot of assistance to people who are on Medicare. So about 9 million low-income Medicare beneficiaries get assistance through Medicaid. Medicaid helps them pay their premiums, cost-sharing, deductibles. So it really helps. Medicaid helps the Medicare program work for these people with low incomes. And Medicaid is also the primary payer and provider of long-term care, because Medicare doesn't cover, even though it's the program for the elderly and disabled, Medicare does not cover long-term care services. That's a function of the Medicaid program.
Mm-hmm. You know, when Medicaid first came about, it was primarily for children to make sure that they could have maybe a healthy start. But now it seems that there is a larger percentage of elderly that in the Medicaid program than children.
I mean, I think that's a great and so important point about the Medicaid program, that when you look at the program, it still is mostly kids and their parents, so about 70% or 75% of the people on the program are kids and their parents. But when you look at where the money is on the program, about 75 or 70% of the money spent is really for people who are elderly and people with disabilities. Because, again, Medicaid covers these long-term care services, so you have a lot of elderly and people with disabilities who utilize Medicaid to get those services, again, that are not covered by Medicare and not covered in the private sector. So a lot of these enabling services and long-term supports are really provided through Medicaid.
You know, the CHIP program is now called the S-CHIP at state level. Describe that program to me.
Well, CHIP was established in 1997, and it was really designed to build on top of Medicaid. So it was designed to cover low-income, uninsured kids who didn't meet the requirements for Medicaid, but were still low-income and couldn't purchase private coverage. So I think really together, though, Medicaid and CHIP have proven to be a real success story. When you look at it since the inception of the CHIP program, the uninsurance rate for children has gone down by about a third, so primarily related to the success of these programs. So, CHIP covers about 7 million children, Medicaid covers about 29 million children, so it's a smaller program, but the two together really have been a success in reaching out and providing coverage to low-income children.
And these are federal programs?
Right, they're federal programs that are administered by the states, so they're really a partnership between the federal government and the states.
And has that been a fairly successful program?
Yeah, both CHIP and Medicaid, when you look at how the uninsurance rates for kids have declined, and even when you look at the census numbers that just came out, you saw while the uninsurance rate and the number of people with uninsured didn't go up by that much, what you really saw was a large increase in the number of uninsured adults that was really offset by an increase in public coverage for kids. So again, you see the program really working as it was designed to really provide a safety net and cover kids. So it has been a success, and also guaranteeing access to services for its enrollees.
I wanted to get more information on Medicare and Medicaid because I know that there is great skepticism on the federal government handling programs. We hear all these ads about a big federal's never been successful, what have you. But Social Security is federal, it's been successful. Medicare and Medicaid are, even though Medicaid is managed by the states, they've been fairly successful programs, haven't they?
They have.
So I guess the government does have some capability of handling some of the overseeing of patients that do not have coverage. And that's really what this public option is all about, is trying to offer a category of coverage where people can pay according to a sliding scale ability to be covered. Has Kaiser taken in position on that?
Well, Kaiser just does research, so we don't take positions and we don't lobby, so leave that to the politics on the public option. But again, it is one of the big differences that's between the House bill and the Senate bill, because the Senate bill does not include a public option right now.
But do they have an exchange? They have nothing that addresses the uninsured?
No, they have an exchange. So the basic framework of the bills are quite similar, and there is an exchange, again, for people who don't have access to employer coverage and who aren't eligible for Medicaid. There is an exchange or marketplace that individuals can shop for insurance coverage. But in that marketplace, in the House bill, is a public option, and in the Senate bill, there is no public option. So that is one of the issues that will continue, I think, to get a lot of attention.
Well, before it becomes law, it'll be all one bill, so the House and Senate's got to come together at some point. I want to thank you for coming and explaining what your research is showing. I have great respect for the research from Kaiser, and we're delighted that you had the time to come. And thank you for tuning in for this week's episode. We're still talking about health care. If you have any questions, just let us know. See you next week.
This has been another edition of Report from Washington featuring Congresswoman Bernice Johnson. You can reach Congresswoman Johnson at 202-225-8885 or 214-922-8885. You can also contact her through her website at http://www.house.gov/ebjohnson.